Concerning folic acid, it's important that they get folic acid supplements, but it is very hard to give advice about dose. But at least 0.4 milligrams. Many argue also for maybe 0.8 milligrams. But rather concerning dose, there are very large variations in guidelines, and the data is not certain. So it's impossible to give. It's very hard to give a certain recommendation. Me personally, in Norway, we measure folates in the blood to make sure that the woman use enough folic acid supplements to reach the level of folate that is recommended by the WHO for women of childbearing age, but also making sure that she doesn't take more than necessary. So I find that a useful tool, but it's not been studied. The usefulness has not been studied in women with epilepsy specifically. So it's also hard to make a broad recommendation. Concerning anti-seizure medication, well, the general advice is that they should, well, if they want to get pregnant, you need to have this discussion with her. Hopefully like around a year before she's getting pregnant, where the most important thing is information and trying to get to a shared decision with the patient. What anti-seizure medication she should use? Obviously, if it's possible, Lamotrigine and levetiracetam would be the two medications to prefer, while Topiramate and valproate would be the two medications to avoid. But sometimes it's not possible to use these safer medications based on her history, and then and newer medication we don't really know. So if other options has been tried, then you have to go with valproate or Topiramate. The most important thing would be to be very clear and give all the information to the patient and be sure that it's a shared decision, and also reassure her that even though there's an increased risk, there are still more children that are not, well, the majority of children will still be, in these studies, are still not at increased risk, even though the risk is relatively higher. So there are still. It's important that the woman also understand that it can be a good pregnancy, and it's a good chance that she will have a healthy child.